Hello there, my name is Matthew Garcia. This is my intramuscular video checkoff. Before we begin, I'm going to go ahead and start by showing you my IM worksheet of the influenza vaccine that I've completed. And I also have the EMS paper chart that I'll be using for Anapolowski as well. Okay, so got that out of the way, so I'm just gonna go ahead and begin. So first thing I'm gonna do is check the prescription with the healthcare provider, check for any allergies. So I see a prescription for influenza vaccine, allergy to penicillin and hives. First thing I'm gonna do is introduce myself. Hello there, my name is Matt. I'll be your student nurse today. Can I have your name and date of birth? And I have Anapolowski, May 5th, 1957. Verify that in EHR, verify that in the wristband as well. Okay, so today I'm going to be doing an intramuscular injection of influenza vaccine that's given once just to prevent the flu. Okay, I'm going to go ahead and verify the 6 patient rights. So I have the right patient, Anapolowski, influenza vaccine, 0.5 milliliter dose, intramuscular route, and 1458 at a time, and right documentation as well. Now, before we begin, I'm going to go ahead and assure patient safety. So the bed is at its lowest height, rails are up, brakes are locked, call out within reach, and there's no clutter or anything. So patient safety is good. Go ahead and close the curtain, close the door, and begin. So no calculations are needed. 0.5 milliliters, there's no calculations needed. So I'll go ahead and just sanitize my hands, sanitize my hands. After sanitizing my hands, I'm going to go ahead and tell you the 3 intramuscular injection sites, which is the deltoid, ventrogluteal, and vastus lateralis. So for the deltoid, where it's located is you find the acromion process, which is the bony part in the shoulder, and then you go 3 finger lengths below the acromion process, and on that fatty part below 3 fingers, you give the deltoid injection site. And for the ventrogluteal, you go ahead and place your hand on the greater trochanter, and then you have your thumb pointing at the groin, index finger pointing at the iliac crest, middle finger pointing at the iliac spine, and in between the index and middle finger, you give your ventrogluteal injection. Now for the vastus lateralis, it is located when you put your palm on the greater trochanter, have your index finger and thumb pointing at each other, forming a triangle. And then in the center of that triangle, you give your vastus lateralis injection right in the center of that triangle. And then I'll go ahead and I'll gather the appropriate materials. So I have my 3 millimeter syringe with the 22 gauge and 1.5 inch needle. And then I have my gauze, and then I have my alcohol pads, I have my medication vial, gloves, and I would also have my EMR medical record, and the sharps container box as well. And then after I gather the appropriate materials, I'll go ahead and verify the 6 patient rights again once I enter the med room. So patient Anapolowski, influenza vaccine, 0.5 milliliters, intramuscular route. Time is 14:58, and right documentation as well. So then I'll go ahead and get the vial, get the alcohol pad, and I'll go ahead and clean the rubber stopper for 30 seconds. After cleaning the rubber stopper for 30 seconds, I'll go ahead and get my syringe, uncap, and I place my I first get 0.5 milliliters of air into the syringe, and then I go ahead and put into the rubber stopper, and I go air to air, so 0.5 millimeters into the air, and I would invert it, go look at eye level, and I'd slowly get 0.5 milliliters of the influenza vaccine. Okay, and I tap out any air bubbles, put it back down. would recap it. Okay, and I'll label it with Anna Pawlowski, influenza vaccine, 0.5 milliliters, my initials, the date, and the time as well. So then I would go ahead and label a syringe. After labeling the syringe, we would go to the patient's bedside, and then I'll verify 6 rights again. So I'd go check the healthcare provider's order, check for the allergies, and then 6 patient rights. So Anna Pawlowski, influenza vaccine, 0.5 milliliters, intramuscular, 1458, and write documentation as well. And then I would go ahead and sanitize my hands. Again, apply my clean gloves. And then I'll go ahead and don my gloves, and then I'd select the appropriate injection site. In this case, since it is 0.5 milliliters, it can be on any one of the sites, but for deltoid, I'll position the patient with arms down on the side, relaxed, with the upper arm exposed. For the ventrogluteal, I would have them lay on their side, and I'd have their hips and knees flexed, having the upper thigh exposed as well. And then for the vastus lateralis, I would have the patient positioned either supine or sitting down. And I would go ahead and have my injection site, get my alcohol pad. I would start in the center, circular motions. I would clean it for 30 seconds, starting from the center, going outwards. After 30 seconds, I would let it air dry. I'd get my syringe with the medication, uncap, go ahead and displace the skin using the Z-track method, and I would insert at a 90-degree angle. So once it's been inserted, I'll go ahead and slowly inject the 0.5 influenza vaccine, hold it for 5 seconds, and take it out and release the skin. Go ahead and assure that the needle safety first, so capped, have it capped, displace it in the charge box, and then I'd go ahead, apply gauze to the site, and a band-aid if needed. Then I'll go ahead and clean the area of any medical supplies or anything anyways. I'll go ahead and document the medication's been administered, anything about the site or assessments that need to be done as well. And I'll take off my gloves, and I'll go ahead and assess the safety of the patient. So bedrolls, lowest height, or bedrolls are up, beds of lowest height, call out within reach, no clutter, brakes are locked. I'll go ahead and ask the patient if they're comfortable, if they need anything, sure they're comfortable, they don't need anything. And I would go ahead and open up the privacy curtain, open up the door, and sanitize my hands way out. And that would conclude my IM video checkoff. Thank you.